I'd like to welcome you to BMORENEWS.com, the news before the news, where we uncover the truth here with Dr. Tom LaVeist. And we're going to discuss the International Conference on Health in the African Diaspora, happening this summer, July 4th through the 8th, 2012, here in the city of Baltimore. Good afternoon, Doc. How are you?
Oh, I'm good. I'm doing great.
Good, good. Tell us about the conference, Health in the African Diaspora.
Yeah. So as we travel across the hemisphere, that is the North and South America, the Caribbean, and Central America, we see people of African descent in all these countries, all having gotten there through the same process, basically, that we came into the United States.
The MIAFA, the transatlantic slave trade.
Transatlantic slave trade. So we share the same history. But, as you go to these different countries, you also see that we share more than that history. There are some things that we share in current times, too. And one of the things that we share is ill health. So I got the idea that, what if we would all come together and start to talk and start having a dialogue across international lines on what was happening in the black communities throughout the hemisphere and what we might do to be able to make progress.
Well, I'm curious, as you mentioned the African diaspora, my understanding is that Brazil has one of the better health systems in the world.
Well, better health systems is all relative, right? So even in the United States, we have the best as well as systems that are not very good.
Oh, okay, Brazil versus, say, the Dominican Republic. Would you say Brazil is better off health-wise? The African American or the Africans there, those of African descent?
My observation of Brazil is that you have a great deal of inequity there. You have some African descendants, Afro-Brazilians, that are doing quite well, hold prominent positions in the society, but I would say that the majority are not doing well, and that
just like the United States, then.
Like the United States.
Would people in Brazil have similar health challenges here in the U.S.? Help me out: diabetes, asthma, heart disease, cancer,
stroke. Yes, exactly. So, the idea for the conference actually came when I was in Brazil. I was in Salvador Bahia, Brazil, walking down the street, and it just struck me how similar Salvador was to Baltimore.
How so?
I felt like I was in the same city. They're both brown cities, mostly black people, about 60% black or more. You look at the same, kind of industrial Rust Belt type city, same kind of thing, same kind of industry. And you go downtown into the tourist areas in Salvador Bahia, Brazil, and you would think that there was a very small black population, if any at all. But when you get away from the tourist areas and get into the community and you see who actually is living in the city, it's the same profile that we see here in our city.
And before I go on, I should have, in the introduction, noted that you are here at the Hopkins Center for Health Disparities Solutions.
That's right.
Johns Hopkins University, considered by many as the greatest health research institution in the world, correct?
I think many people would say that.
Okay. So tell us more. How about Africa? I would think malaria is a challenge there. Nutrition.
Right. So, Africa, so the conference is focused on the Western Hemisphere.
Okay,
so we're
okay.
including Canada to Argentina and everywhere in between. And that is the black descendants of the African slave trade and sort of what's happening now.
The best diet in the Western Hemisphere for black people. The Caribbean?
Well, the Caribbean, again, there's a lot of variation. I was just in Trinidad last week, and I see in Trinidad we now have rising obesity where you didn't have that.
In Trinidad?
In Trinidad, yeah. I see environmental hazards there. Port of Spain, Trinidad, the harbor there looked like the Baltimore Harbor.
The water's dirty.
The water's black. The only place in the Caribbean that I've been where the water is black. So,
Trinidad,
Port of Spain, Trinidad. Yeah.
From oil runoff?
Yeah, there's a
manufacturing.
There's a major shipyard right next to the large resort hotel, which is right near a landfill, which is just a few blocks away from the city's central power plant. All environmental health risks, all together, condensed in a single area. Much similar to what you see in many parts of this country.
Cigarette smoking.
Yeah.
Is it across the board? More prevalent in the U.S.? Less prevalent in the Caribbean?
Well, I don't have the data on that, but just my observations looking around, I think there's probably more smoking in the U.S. than I saw, certainly more than I saw in Trinidad.
What about stress? Who's more stressed out? black folks in the Caribbean, black folks in North America. I mean, they are doing things such as, you know, the sad, unfortunate, clearly racist incident that everyone is talking about across the world of the young Trayvon Martin in Florida.
Yeah. Well, you know, I think that, you know, stress is a relative thing. And it's a hard thing to measure for an entire society. But I think that all black people who share that history of the Middle Passage, slavery, and then second or even third class citizenship, dealing with some level of stress.
Now, I've heard this term, and I'm going to put you on the spot. I've heard this term twice this weekend, and both times the Trayvon Martin case came up.
Yeah.
Second-class citizen. I have a pretty good idea of what a second-class citizen is. That's not first.
Yeah.
I mean, here in America, presumably white people are considered unofficially white first-class citizens. Black people, the masses that aren't doing well, second class. What is a third-class citizen?
Third class. Well, I would say a third-class citizen is a citizen who either has no rights or whose rights are not respected and not protected.
So that would be in this country for the illegal immigrants,
you can think,
Mexicans.
You can think of it that way. Sure. And it was certainly during the Jim Crow period in this country, I would say African Americans were not second, but rather at least third-class status, because there were laws that actually not only did not protect African Americans, but laws that actually made life harder for them.
Okay. So from July 4th through the 8th, what's the goal and, you know, some of the expected outcomes?
Mm-hmm. The primary goal is not just to have a conference and talk, although we're going to do that, but the goal is to create a network of people across international lines that are communicating with each other, that are learning from each other, and that are teaching each other. There are things happening in all these countries, but we don't communicate across international lines.
Heck, we don't communicate across Charles Street sometimes, East Baltimore, West Baltimore.
Yeah, that's true too, but you know, hopefully we can bridge that gap too.
So social media will be a part of the conference?
Certainly. Well, we do have a Facebook page that we're still building, and Twitter, and you know, hopefully, you know, some of your viewers will look us up on Facebook, and it's facebook.com/ICHAD Summit, ICHAD Summit, and join us so you can keep track of the progress that we're making. We also have a website, which is ICHAD.com, ICHAD.com.
And again, that's the International Conference on Health in the African Diaspora. Dr. Tom LaVeist, tell us a little bit about yourself. Who are you?
Who am I? Well, you know, I
mean, we've got a lot of books on the wall.
I am a transplanted Baltimorean. I've been living here 21 years, originally from New York, and came here, fell in love with the city, as well as a Baltimore native.
And see, I was going to put you on the spot. Do you eat crab meat?
I'm a vegetarian, so I don't eat
right,
any.
So you escaped the crab cake question, the best crab cake.
I used to eat crab cakes. Yeah.
What was the best one?
I'm doing a commercial. The best crab cake that I had in Baltimore was at Windsor Inn in Windsor Mill.
Oh, okay. You've been around. Let's see, if you said somebody's mama's house, that was a safe way out. What would you say your legacy is here at Hopkins, or what would you want your legacy to be or remembered as? Your body of work. What are you most proud of?
I think the creation of the Hopkins Center for Health Disparity Solutions.
Why?
The center focused on understanding why it is that African Americans live sicker and die younger than every other ethnic group in America, and not just why, but what we can do about it.
What can we do about it?
Well, that's what we're still working on. But one thing that we are working on creating policy, and we have had a lot of interaction with policymakers in Washington and helped to push legislation through that have, for example, the Affordable Care Act. That's
by President Obama.
By President Obama.
Even this week.
That's going to be, and it'll be, the case will be heard at the Supreme Court on the health insurance mandate part of that law. But even without that, there's a lot in that law that I think can be very helpful in improving health for everybody.
Would the ICHAD conference touch on the impact of racism?
Of course. I mean,
because I've met a lot of white people who don't seemingly get it, the impact. We can just look at the Trayvon Martin case. And the irony of the Trayvon Martin case, if you will, is that this gentleman has a Jewish ethnicity as well as a Hispanic or Latino background.
Right. Well, racism is, I mean, if you're going to have a topic like this, it's unavoidable that racism is going to come up, because when you look at what are the commonalities across all of these countries, racism is one of the commonalities that we're all facing. I mean, and I'm a journalist, so I wouldn't at all claim to have expertise in the field of mental health, but isn't racism a mental illness? Yeah, there are some who argue that. Yeah, there are some people in the mental health community. It's not my expertise either, so I can't speak authoritatively about it.
Well, your mother told you that nobody was better than you growing up, right?
Absolutely.
And that you weren't better than anybody else.
Absolutely.
What happened to these racists? Their mother didn't tell them that? I mean, Hitler tried to put Jesse Owens or black people in a box, and Jesse Owens came out and broke all of his propaganda, his prejudices.
Well, I guess Hitler's mother didn't tell him that. Right?
Okay. One final plug. On July 4th through the 8th, the International Conference on Health in the African Diaspora. This is being put on by Dr. Tom LaVeist and your colleagues here at the Hopkins Center for Health Disparity Solutions.
Yes.
Okay. Any final thoughts?
Jess, you know, we want to showcase Baltimore as a world-class city. We're going to have a world-class conference. We're going to bring the world here to our city. We want to feature the city and show the best of what this city is about. And hopefully some people from the city will actually come to the conference.
Well, that's why you're here on BMORENEWS.com. We have pretty good outreach. We've reached about we get 1.3 million hits per month, and we reach about 140 different countries around the world. Okay. And this is going into our 10th year. So
great. Well, then please come to the website.
And Johns Hopkins has been kind to us over the years.
Please come to the website, come to the Facebook page, follow what we're doing, and find a way to get involved.
And on that note, a big plug to one of your colleagues, or at least extended colleagues, Dr. Phil Leaf. Keep watching BMORENEWS.com, the news before the news, where we uncover the truth.